Good afternoon. This is a presentation over prescription drug abuse, a college epidemic by Crystal Stautzenberger, Psych610. Prescription drug abuse is referred to as the non-medical abuse of a prescribed controlled substance. This type of abuse spreads far and wide with many different types of drugs being abused. However, this presentation will focus on the abuse of prescription opioids as a national concern and the abuse of prescription drugs among the college population. The most abused opioids are hydrocodone, which is also known as Vicodin, oxycodone, which is known as Oxycontin, Percocet, oxymorphone, which is known as morphine, codeine, and fentanyl. And these types of drugs are typically prescribed to treat chronic pain. Now, among the college population, methylphenidate, which is also known as Ritalin, is a prescription drug that is often abused. Methylphenidate is a central nervous system stimulant, and it's often used to treat ADHD. The extent of the prescription drug abuse epidemic is vast and holds a high addiction and death rate. One study revealed that the death rate from prescription opioid overdose has increased dramatically in the United States alone, quadrupling in the past 15 years. Pain management focus has resulted in higher rates of opioid prescriptions, and this rate increase correlates with the increase in opioid addiction, overdose, and death. In an effort to examine the prescription drug abuse epidemic, we must review Bandera's reciprocal determinism theory as it relates to prescription drug abuse. According to the psychologist Albert Bandera, reciprocal determinism is comprised of three main factors which influence an individual's behavior: the environment, the individual, and the behavior work synergistically to influence behavior. When examining the environment piece of this theory, we look at the physical surroundings that may perpetuate certain behaviors. We pay close attention to the organizations an individual is involved in or certain people who are present or absent. Fraternity and sorority homes or a doctor who is quick to prescribe opioids are examples of environmental factors. As for the behavior component, it is important to understand that an individual who is abusing prescription drugs may be triggered due to certain behavioral reactions to specific situations, like experiencing anxiety or stress. Reward is something that highly influences the individual component along with personality traits and expectations. So if an individual who typically eases or experiences anxiety with prescription drugs and finds ease in that prescription, which is the individual component, they see a doctor who overprescribes opioids, that would be in the environmental component, and he or she may continue the habit of abusing the prescribed drugs, which is the behavioral component. Another factor when it comes to abusing prescription drugs, especially among the college population, is the social influence theory, which is a range of influence techniques. Two types of techniques are non-conscious and unconscious processing. Non-conscious techniques are powerful because they change behavior without realizing it. This type of behavior influence can be shaped by being responsive and non-responsive. You may know someone who was introduced to a type of drug via relationship, for example. Some people experiment with drugs because of the influence of other people. Think about the girlfriend who receives more attention from her boyfriend when she is engaging in drug use. This is a type of non-conscious technique that may shape the girlfriend's behavior without her realizing the root cause. If we continue with this scenario, the girlfriend may eventually begin to see herself as a normal drug abuser. She has unconsciously processed a belief about herself that originally was not true. This type of influence is a powerful tool. We can peer deeper into this social issue by looking at prescription drug abuse within the college population. Some of the most widely abused prescription drugs among the college population are drugs that are prescribed for ADHD. Recent studies show that white members of fraternities and sororities, students with low grade point averages, as well as those who report symptoms of ADHD are some of the more common abusers of this type of drug. There are three main reasons that students report to abuse these prescriptions, and they include concentration, alertness, and experimentation. Prescription drugs have been abused for a very long time, but there are many researchers, especially in the field of social psychology, who are striving to end this epidemic. Various thoughts have been laid out on how we can detour individuals, especially college students, from abusing prescription drugs. Some suggestions include determining the extent of the issue and consequences that should be placed on those that choose to abuse prescription drugs, launching a social media campaign to educate and inform students of the effects and consequences of drug abuse, improving prescription drug laws, and to create an awareness movement that magnifies the social influence theory to influence students not to abuse prescription drugs. It has been discovered that prescription holders are more likely than non-holders to report illicit drug use, which is why improved prescription laws would benefit this overall issue. Prescription drug abuse is not slowing down. It is a social issue that psychologists will continue to examine and work to find better strategies to fight this widespread epidemic. Thank you for viewing.